Hi everybody, thanks for tuning in. Today I'm just going to talk about scientific proof and urine therapy. I get a few people bugging me saying there's no scientific proof and all this, banter on about it's not proven. Now here's the ironic thing. Scientific proof doesn't really mean too much, even in the scientific proof world, because scientists can prove a certain medication can be good for you. And how they do their test is manipulated. They can have 10 healthy people do the test and 10 healthy results. But when they want to dish you and say that your drug is not good, they'll test it on sick people. And of course, really sick people aren't going to survive, and therefore they say your particular drug isn't that good. So, not only that, but you need tens of thousands of dollars to organize tests. So for someone to spend, millions and millions of dollars on testing urine and the theory of urine therapy, no one has the money. It's free. It's the most incredible free substance, organic substance that you have in your body. Why would they spend hundreds of thousands of dollars proving that it works when you can have it free on tap? Why would you go to the doctor? They'll be out of business. Pharmaceutical companies would be out of business. So then we come to proof. Now, this is my book, and I have spent maybe 3 years researching everything for the film that I'm doing. Everything is in here. So I've got files on top of files. Now, the MCL, Miracle Cup of Life, this is an actual copy of the original book, which was published in Japan, is a clinic. And they did their own independent clinical studies. Now, how do you do an independent clinical study without letting the patient know you're drinking urine? You can't. You can't do a double-blinded test where the doctors don't know and the patients don't know, because people know they're going to be drinking their own urine. So you have to do the tests with the patient knowing. In the test that the MCL made, basically they used a tube and bypassed the throat and then poured the urine down the throat, passing the mouth straight into the body. This proved actually to not be as effective as urine that stays in the mouth. And the reason being is your glands and your mouth receive the information. Therefore, it sends the cells, it sends the messages to heal the body. That was quite fascinating. So it was more effective. The longer you leave it in your mouth, the better it was. Now, just recently, the urine therapy clinic in India, in Indore, which I went to film, has sent me, basically they did their own independent tests as well on asthma on patients, because they use cow urine and herbs. Out of the clinical test, it says they trialed 20 patients. Now, people think that's not a lot of people. 20 patients is not going to prove anything. Most medical science, they may only use 5. They may use 4. You don't know. And this is the thing. They can make something out like, oh yeah, it worked. We tested it on 5 people and 5 people healed themselves. Is that enough evidence? According to the FDA, it is. That's all you need. So, on their 50 to 20 people that they've been researching, in asthma, pretty much 98% people were cured of asthma. And this is from cow urine therapy. So, there is scientific proof out there. That's only a small amount. There is much, much more. If you check the American Federal Medical Journals, there is writings in there as well. Hard to find, buried deep down, but all in there. If the pharmaceutical and the medical industry thought that this didn't work, then the question is, why do they use it in their medications? They use it in heart medications, they use it on skin care, they use it in all sorts of products. Urea, being the main component of urine, is widely spread. It's a billion-dollar industry. So, go figure. If it was not working, why would they buy it and spend that kind of money? So ponder on that. But you've got the web. The web is out there. You can do your own research. You've just got to dig and spend the time and effort. So far, I've spent 4 years of research into this, and I've only scratched the surface. So, for all those yay-nayers who say, oh, no medical proof, I can say to you, there is. Well, thanks. I hope you like this video. Please subscribe, building up the subscribers, and I'll keep up the videos. Thanks very much. Bye.